Hi, my name is Dr. Brian Kerr. I'm coming to you from Legacy Dental Group. Today I'd like to discuss dental implants. What are they and who are they for? Dental implants is a man-made root replacement option for teeth. They're made out of 100% titanium. This is an example of a dental implant. Generally, there are 2 or 3 pieces. The first piece is the dental implant itself. It is embedded in the bone at bone level. After a few months of healing, we take an impression, we make a piece that screws into the top of the implant, which is above the gums, and then your tooth goes on it. Dental implants are the standard of care in implant dentistry these days. Why is that? Our options previously, if we had a single tooth that was missing, if it were between 2 teeth, was to replace it with a bridge. But in placing a bridge, we have to take tooth structure away from the teeth on either side. Dental implants is a 1-tooth solution to a 1-tooth problem, whereas a bridge or other options usually involves many more teeth. And when problems occur with that, you're just multiplying the problem. Using dental implants to replace teeth, we have many options. Not everyone can afford to replace all their teeth with dental implants or multiple missing teeth with dental implants. They give you many different options. This is an example of an individual that would have a full denture. We have dental implants and then pieces called locator attachments that are placed in the denture and it snaps into place. Very good option for many teeth missing. Certainly one of the most affordable and highest benefits when somebody's missing a lot of teeth. When you're missing an individual tooth, a dental implant is a great option for individual tooth replacement. It gives you normal function, you clean it normally, and we don't damage the adjacent teeth. People often ask, is this a replacement for a crown? No. Crown is when a tooth is broken down or fillings, but we still have plenty of root structure and there's enough tooth to replace the top of the tooth. A dental implant is a replacement when a tooth is no longer fixable and needs to be extracted, often from a fractured root, broken during trauma, and the entire tooth, root and all, needs to be removed. Often a question I'm asked about dental implants is, how long do they take? Single dental implants, when you're replacing 1 tooth, are often done over about a 3-month period of time. That allows time for the bone, we screw the implant into place, surgically placed, and the bone integrates, we call it osseointegration, where the bone heals to the titanium itself. After it's healed, we uncover the implant, we take the impression and make the crown that screws into place on top of the implant. Another common question with dental implants, do they hurt? Depending on the type of surgery that's done, if someone's already missing their tooth and we're just placing an implant where there is no tooth, there's very little discomfort with the surgical procedure. Nobody believes me, but most people say I didn't even need Tylenol. When somebody has to have bone grafting, that can be uncomfortable, but it's much like soreness of the jaw. It shouldn't be tremendously painful. Lasts about 2 to 3 days, and then you recover and heal normally until we're ready to place the implant or uncover it and put a tooth on. The pain in that case when somebody has implant surgery, if it's related to bone grafting, is usually a dull ache. And we treat that with medication to keep people comfortable for the 3 or 4 days that it's uncomfortable. When we're placing dental implants, often people ask, am I going to be put to sleep? And here at Legacy Dental Group, we have all the options. There's different levels of sedation. Often people are fine with nitrous oxide gas, which helps, but for many people is not sufficient. People that have high phobia or anxiety, we like to use other options. One is oral pills. Great thing about oral sedation is it's easy. The problem with oral sedation is we cannot control the level of sedation you have. So if you get here and you're not quite comfortable enough, there's not a whole lot of options. And the third and probably most predictable method is IV sedation. People ask, what is IV sedation? IV sedation is a conscious sedation. You're asleep, but you breathe on your own. You're not intubated. During sedation, we monitor all vitals, your heart rate, your blood pressure, CO2, monitoring our CAP technology, oxygen saturation, and there's always an additional person in the room that's just monitoring the patient and the monitor to make sure all vitals stay within normal ranges. At Legacy Dental, we offer IV sedation because we believe for a lot of people, it is the best option. There are traumas in previous dental visits that make it a phobic experience for patients. And it is truly the best option to keep people comfortable. I've had patients that are so frightened to come into the office, they physically get sick. And those patients having IV sedation as an option have gotten to where they're laughing and joyful coming in, knowing that they're not going to have any problems and they're comfortable. It really allows people to take care of their oral needs and their oral health care without having to fear and have a traumatic experience. I hope this has answered some of the frequently asked questions regarding sedation and implant dentistry. If you have any further questions, please don't hesitate to reach out to Legacy Dental Group. We'd be happy to have you in for a consult and answer any further questions.